Hello everyone, welcome to the ADA Accommodations Scenarios for Faculty.
My name is Judy Spain. I'm with the Georgia Independent College Association as the Compliance Collaborative Program Consultant.
And I'm Jennifer Wilson Loggins, the Learning Center Director and Disability Service Provider for Brenau University.
Today we're going to be presenting to you several different scenarios. We're going to present the fact pattern, some different options for you to consider, and then what would be the correct answer here at Brenau University. So the first scenario is a student approaches you after the first class when there are at least 3 other students trying to ask questions. The student reports a depressive order, which will cause the student to miss classes. Additionally, the student reports diabetes and asks if a drink and snack is allowed in class and says that it's probable that some classes will be missed because of doctor's appointments. What do you do? So what is going to be the right response? Do you inform the student that if classes are missed, you will apply the consequences listed in your syllabus? No special treatment is allowed. It's your class and you can do what you want because of academic freedom. Or B, be understanding and ask the student to tell you more about these illnesses and try to relate these health issues to your own or those of another student with whom you've worked. Give advice and suggest medical treatments that may help. Or C, ask the student to call or email you to set up an individual appointment in the privacy of your office. Or D, tell the student that no considerations are made without an accommodations letter. So what should you do?
So here at Brenau University, the correct answer is C, but why? So A, if a student qualifies for reasonable accommodation under the modified attendance policy, you can work with the Learning Center to determine how those missed classes are considered. Do not exclude this option by telling a student who reports a disability that they're held to the attendance policy without exception. Federal disability law always trumps the concept of academic freedom. B, do not start into a conversation about a reported illness in front of other students from the class nearby. And remember, always create a confidential setting for these kind of conversations. But also remember, which is especially hard sometimes for those of us in the helping professions, that your role is not to be the student's medical or therapy provider. C, if you chose C, you got it correct. So asking the student to meet with you in a confidential setting is the best way to start these conversations. Then, when in that private setting, you can refer the student to the Learning Center. And D, listen and then say, I understand. Once I have a letter from the Learning Center, we can meet again to finalize the accommodations for which you are eligible. So D is not necessarily wrong, but a lot is conveyed by tone or the word choice. So if you say it in a negative way, well, you're not going to have any accommodations, until you give me that. Simply say it in a more positive way. I do understand, and once I have that letter, I'm happy to provide those accommodations.
So the next scenario, a pregnant OT student is about to start her internship at a local hospital. The internship is for 12 weeks, and she has informed you that her due date is 6 weeks into the internship. She is one of your better students, and this is a highly prestigious internship. What do you do? So what is the right response? Could it be A, tell the student that she is not eligible for the internship since she cannot complete the 12 entire weeks consecutively? B, ask the student to contact the Learning Center to document any pregnancy-related need for reasonable accommodations. State that you will follow those recommendations to address this issue. Is it C? Tell the student that missing part of the internship will be counted as absences, but you will meet with the student to discuss options for completing the internship. Or D, send an email to the hospital explaining that a pregnant student is scheduled for the internship and the hospital must not make her lift anything heavy or do anything that could harm her or the fetus. So what would be the right answer?
So we want to definitely throw out A and D right from the start. There are 2 correct answers on this question, but let's first look at the incorrect answers. So A, we're in trouble legally if we do A. Informing the student that simply because she's pregnant that she's not eligible for the internship, you're violating some laws here, and we don't want to do that. We're violating Title VII and the Pregnancy Discrimination Act as interpreted through Title IX. Also, D is not a good option because if the student is qualified to be in this internship and to complete it, then then she does not need someone calling the hospital, and she simply needs a reasonable accommodation. Those conversations should take place with the Learning Center and the hospital Human Resources Department if requested by the student. And so let's not do D. So the correct answers would be B and C. B is correct because informing the student that you need to hear from the Learning Center and they will set forth the procedures for addressing this issue then protects you. You have guidance and a clear path forward. C is also correct in that any student who's missing a certain number of days of a class or internship still is absent. The question is what is your departmental policy in reference to modified attendance policies, or at what point does a certain amount of days cross that line and become a fundamental alteration of the program or the class? And each department has different programs, and you have to determine as a department this many days of class is going to cross that line. Some programs lend themselves more to absences than others. Some things you just cannot miss much of, and that's okay. This should be a policy that is for all students and not just pregnant students. So any student could have a modified attendance policy as an accommodation, and then you would simply honor that.
So another scenario. A student in your class leaves the room abruptly halfway during the first class meeting and then emails you afterwards stating that they have a chemical sensitivity to perfumes, and during the first class they started experiencing a bad reaction to a student wearing cologne. What do you do? Well, what is the right response? Could it be A, tell the student that you will make an announcement at the onset of the next class meeting that students are prohibited to wear perfumes or cologne to class? Could it be B, ask a student to contact the Learning Center to document the need for chemical sensitivity and that you will follow their recommendations to address this issue? C, tell the student that missing part of the first class meeting will be counted as an absence, but that you will meet with the student to discuss the situation. Or D, send an email to the class explaining the situation and asking students to be kind and to be considerate to all students by not wearing perfume or cologne to all future class meetings. So what would be the right response?
So we only have one correct answer in this case. Let's go through the incorrect answers and why those would not be good options. So A, informing the class at the onset of the next class meeting is too late to inform the students. And so what if the student comes again with cologne? The student's going to have another absence. This is too late. C, if the student had to leave class due to a reported bad reaction to cologne or perfume, it's not wise to give out consequences without considering documentation. Advise that the student contact the Learning Center and that you will follow protocol. Offer to meet with the student to review what was missed in the first class. D, while sending an email notice regarding the university's chemical sensitivity policy to the class is appropriate, this policy should be followed. The policy is considered a responsibility for classmates and is not regarded as being kind. It's simply the law. So we go back and we only have one option, B. B is correct. You want to inform the student that you need to hear from the Learning Center, and they will set forth the procedures for addressing this issue while keeping the student's name confidential.
Let's go for another example. A student in your class reports that even though you have tried to maintain a reduced distraction testing environment for the HESI exams, he wants to test at the Learning Center because this is where he always takes his other course tests, and he just feels more comfortable there. So what do? What could be the right response? Could you tell the student that the HESI exams cannot be provided at the Learning Center due to IP address IT restrictions? Could you ask the student if there's anything specific about the environment that is distracting? Could you tell the student you have never had any requests like this before and the environment is already reasonably quiet? Could you send an email to Learning Center Director to discuss the student's request and determine if anything else can be done to reduce distraction in the testing environment? So what should you do?
So the correct answers at Brenau University are A, B, and D. But why? Let's look first at the incorrect answer, which is obviously C. So C is not a good answer because former or other student accommodations have no bearing on this student's situation. Just try not to shut down communication. Instead, try to engage in the interactive process, which is the hallmark of making a good faith effort to honor accommodations. You want to refer the student to the Learning Center so that I can engage with them as well. So since you got a 75% chance of getting this one correct, so if you chose A, B, or D, you are correct. A is correct because you can tell students about legitimate limitations, IT limitations, but you do need to work with the student as part of that interactive process to try to see if there's a way around that limitation or if there's something specific that's distracting the student that could be remedied. B is correct because engaging in the interactive process to determine if anything specific is distracting about the testing environment does show you're working in good faith to honor those accommodations, even in light of all the limitations that sometimes exist. And D is correct because you can always email myself regarding testing accommodations and any questions regarding how accommodations are honored. And I do encourage you to reach out if you don't know how to add time in Canvas. If you have a strange fieldwork situation and you've never dealt with that type of disability before, you're not sure what fieldwork setting is appropriate, please do feel free to reach out and we can collaborate. My door is always open and I am more than happy to talk through just ensuring compliance on any level. Thank you so much for attending.